Imagine being trapped in your own body, unable to speak or move, while the people meant to save your life are discussing an overdose that you never had. This was a terrifying reality for Kevin Wake. Kevin, a successful pharmaceutical sales rep, called 911 when he realized he was having a stroke. By the time the ambulance arrived, Kevin lost the ability to speak and move his entire right side, but he was still fully conscious and aware of his surroundings. The EMTs assumed that he was overdosing, not based on any facts, but simply because he was a Black man living in Chicago. Kevin was presented to the emergency room as an overdose case, despite his actual condition. In a miraculous burst of strength, Kevin managed to signal for a pen and write down the 3 words that saved his life: sickle cell stroke. Now, Kevin's example is not an isolated case. It's a stark example of the racial disparities that plague our healthcare system. Today, we need to think again about how we approach racial representation in medicine. First, let's talk about why representation is important in healthcare in the first place. It's more than just a number, it's a matter of life or death. If you're a person of color, your chances of misdiagnosis are significantly higher. Research shows that Black patients are 22% more likely to be misdiagnosed than their white counterparts. This inequality doesn't come from where you live or how much you earn, but rather more deep-seated systemic issues. It comes from cognitive bias, decades of clinical research focusing predominantly on white males, and also a lack of understanding about the social determinants of healthcare. All of these factors come together and create severe disparities in the quality of care that patients of color receive. Now, let's talk a little bit about the types of biases found in medical training and how we can work to address them. There are 4 main factors in this: implicit bias, a lack of trust, reduced access to care, and missing clinical data. Firstly, implicit bias, which is often subconscious and affects our decisions in ways that we may not even realize. Implicit bias can lead to symptoms being interpreted and assessed differently, especially when it comes to pain management. A study conducted by the National Library of Medicine found that over 90% of white medical students mistakenly believe that Black patients feel less pain than their white counterparts. This is a dangerous issue to have, especially for the future of healthcare. This leads to inadequate pain management, with Black patients being far less likely to receive pain medication than their white counterparts. We can see this in Kevin Wake's example. He sat for over 6 hours in an emergency room with no pain medication, which is just one prime example of this. Now, let's also talk about the gaping hole of missing data from clinical studies. Historically, clinical studies have been predominantly focused on white males, overlooking other minority groups and how different conditions affect them. In fact, this has led to us having not a very good understanding of how different conditions present themselves, particularly in darker skin tones. For example, erythema, which is a condition that presents itself differently on darker skin tones. It often goes misdiagnosed because medical training overlooks how this develops on darker skin tones and focuses more on lighter skin tones. This leads to fewer, less accurate diagnoses being made and can reduce the quality of care for patients of color. Now, trust is another crucial factor. There's a deep-rooted mistrust among people of color when it comes to the medical system, and this stems from historical injustices like the Tuskegee syphilis study and the case of Henrietta Lacks. In the Tuskegee syphilis study, hundreds of Black men were unknowingly left exposed to syphilis by the US government. Even when penicillin became an available cure, these men were denied treatment and left to suffer the devastating consequences of this disease. This violation of ethical standards and human rights has left deep scars on the African American community. It's left communities in a state of mistrust and fear, making it difficult for them to trust medical professionals and actually participate in clinical trials. All of this contributes to reduced access of care for patients of color. Additionally, patients of color also face reduced access to care. Patients of color often face longer wait times, fewer doctors in their areas, and have higher rates of being uninsured. This presents a big problem. Black and Hispanic people are often 25% more likely to wait in the emergency room than their white counterparts, leading to higher rates of consequences from diseases such as stroke, diabetes, and cancer. Now that we've shed light on some of these deep-seated issues, it's time for action. But this is not a call for sweeping reform or grand gestures. It's a call for humanity, empathy, and individual action. Doctors are in a unique position to do this. By building meaningful relationships with their patients and truly connecting with them, they can not only improve the quality of care, but also help restore faith in the healthcare system as a whole. It's about seeing each patient as their own person, with their own struggles, their own aspirations, and their own journey. When patients feel heard and understood, it can make their journey all the better. Now, we also have to talk a little bit about cultural competency and the role that it plays in compassionate care. Doctors need to make sure that each of their patients is feeling heard and seen, and that all of their cultural backgrounds are respected. By practicing cultural humility, listening to their patients, and honoring each of their unique perspectives, doctors have the unique ability to bridge the gap between various communities and contribute to a better healthcare system for all. Now, we also need to make sure that medical literature and education is updated. We need resources that reflect the diverse population that we have, and resources that can adequately equip doctors with the things they need to help provide a more equitable world. Now, if you think that medical professionals are the only ones that can make a change, you're wrong. Each one of you in the audience is just as capable of transforming the healthcare journey. Take Kevin Wakes, for example. Even after facing medical bias and racism, he didn't stop there. He became a passionate advocate in his community and spent hours volunteering with a local sickle cell organization to help better the stigmas and help better treatment for everybody. Now, he wears a medical bracelet, not for his own safety, but to rather challenge the stigmas associated with sickle cell disease. Inspired by Kevin's journey, each one of you can do the same. Whether it be wearing medical bracelets or just participating in clinical trials, we have the power to be the change that we want to see in the world. If we come and we step up for clinical trials, we can make this an all the more diverse landscape. We can also make sure that diverse points of view are heard and that treatments can be available for all, regardless of race or skin tone. We need to make change, and we need to make change now. So sign up to volunteer, advocate in your community, and be the change that you want to see in the world. Thank you.